Very good. Start, madam. See, last we started with Chelidonium. If I remember, this was the last slide I had displayed. Okay. Now, constipation, diarrhea. Anyway, we will be looking at this again. Constipation, diarrhea, and we also spoke of skin. Now, under skin, very important thing, what I mentioned was old putrid spreading ulcers with a history of liver disease or tubercular dialysis. See, many things in Chelidonium you will realize it is all related with liver. Okay, I will be giving you a few more examples. I will be showing you a few more symptoms. Majority of the things in Chelidonium, they will be revolving around the liver. And as a second year student, for you, this piece of information in Chelidonium is very, very important. As per the new CBDC, I was just trying to tell you, this is what we call it as the must-know area in Chelidonium. Okay? And what was this all about? The last slide we saw pneumonia with liver complex. So that's what I was just trying to tell you. Everything in Chelidonium is around liver. Okay? So this was pneumonia with liver affections. So this is where we had stopped in the last class. So in today's class, we will be focusing on the remaining part of Chelidonium. Must be 30-40 minutes. We'll try to cover the remaining part. And of course, we'll also try to compare. We'll try to have some quick revision. Now, as I was insisting, the best way of knowing if you have understood or not, what we teachers do is we generally come up with some small questions. Okay. So now, what was done in the previous class? If you remember, we spoke of 2 or 3 small areas. One was sphere fraction and pathogenesis, and the second area was ailments. But unfortunately, the only ailment that we got in Chelidonium was change of weather. Very good. I am happy you remember. Change of weather was the only ailment we had. And we had better remedies for change of weather. Dalkamara, Arsenicamara, Restox, Bryonia. And when Bryonia? When do you think of Bryonia? When? Days are hot? Yeah. Yes, apart from that, you also have something very important in Bryonia. Change of weather from cold to hot. When from winter, when the transformation into summer, that's when you will think of Bryonia. Exactly opposite is what you have in Dalkamara. From summer, from heat to cold. When there is this transformation of weather from summer to winter, you can think of Dalkamara. Okay. So change of weather was the only ailment we got. We'll have a small understanding. We'll be looking at true or false. I'll be giving you 4 statements, and you'll have to just tell me if the statement I've given is correct or wrong. Very simple. Just to keep it going. Tongue in Chelidonium is coated white. What makes you feel it is false? So tongue, the right answer is tongue in Chelidonium is coated yellow. Only yellow? With imprint of teeth. Very good. So that was the first thing. Good, keep it up. Second thing, common name of Chelidonium is what weed? True, sir. True. Why is it called what weed? So in olden days, before we proved it homeopathically, what weed? Good, correct. It is predominantly a left side of So is it correct or wrong? So the answer is false. And the correct answer is Chelidonium is predominantly a right-sided nerve. We'll explore more a little later. And one last thing for you is, it affects liver, lungs acting through vagus nerve. True or false? True. Why you are taking so much of time? Pneumogastric nerve or vagus nerve? Which are the other remedies acting on the vagus nerve? And to certain extent Naxphamica. Okay. So we'll go ahead. Again, we have three small questions coming up from the topic that we had already covered. Now what is that topic here is character of pain in Chelidonium. What is the character of pain in Chelidonium? Radiating pains, okay. So where do you see the pain in Chelidonium? But from where? Okay, there is a constant pain in the inferior angle of this scapula, left or right? Right. Okay. So that's one thing good. And second question is character of neuralgia in Chelidonium. Okay, one thing is periorbital neuralgia, good. And then what was characteristic in Chelidonium? With excessive lacrimation. There is neuralgia with excessive lacrimation, and neuralgia is predominantly right side. Good. Last question. Character of stools in Chelidonium. Sheep round, wall-like stool, and there was something else that. Okay, alternates with diarrhea. One more point. I thought sheep tongue round. It is clay color. It is clay color. You agree with this point, the last point? And I also gave you a small reason why it is clay colored in Chelidonium. What was the reason given? Because of obstruction. What is obstructing? What is obstructing? See, bile is getting obstructed, absolutely right. But what is obstructing the bile? Stone. Gallstone. So gallstone can cause an obstruction of common bile duct CBD, and then it can give rise to clay color stool. And we also try to integrate from the knowledge of physiology that the stool color is because of bile pigments. Starco, correct no? Starco bilinogen and starco bilirubin, something. There are two bile pigments. Yeah. Say don't testify. Okay, but they are the one they give color to the stool and urine. Correct. Don't put me into confusion. Bile pigments. Correct. Okay, chalo. Please go back to physiology and do read, because your physiology is very fresh. My physiology is beyond your age. So that's what I was trying to understand. Must be, with advancement, did color for stool also is changing. But I don't think it's changing, it's the same. So please go back, read and get back. So see, today's session, which I promised we'll be trying to complete positively within 30-40 minutes, we'll be looking at few areas of Chelidonium. Though the incomplete part of Chelidonium, keeping a second year student in mind, is what we are going to discuss. So what are the objectives for today? The objectives are very simple. If you just look at this, you all know the moment we talk of Chelidonium, what comes to our mind is liver. Or at least if it is not come, just make sure it should come. Fine? It should come, it's very important. It is an organ specific remedy. See, as you start understanding Chelidonium more in detail, you will also realize that Chelidonium is not only a liver remedy. Must be PGs. When you start, or when you come to PG, when you start understanding Chelidonium, you will realize there is so much Chelidonium has got to offer other than liver. But I am trying to tell you, keeping the limitation of me teaching to a second year student, I will be focusing on the must know areas, and one such must know area is you should know about the action of Chelidonium on liver. So that will be our first area. Describe the liver affections of Chelidonium. This is what we will be looking at. And second, it also has an affinity for lung. We will try to explore what is Chelidonium doing acting on the lungs. That will be our second objective. And third thing, nerves. There are beautiful remedies in our homeopathic Metra Medica acting on nerves. When will you think of Chelidonium? Is what we are trying to conclude in today's class. So the affinity of Chelidonium nerve, or mention the nerve affections of Chelidonium, and we will be concluding today's class with the modalities of Chelidonium. What aggravates and what ameliorates in Chelidonium. So these are the four objectives I have planned. Okay. So we will slowly try to take up each objective. And the first objective, as we just realized, was the liver. The liver, okay? Now before that, a common problem that we keep getting from students is, sir, particular symptoms are very boring. Or particular symptoms are very confusing. Now how do I, as a second year student, remember particular symptom? So I have been insisting on a small formula, fine? And what is that formula that we are looking at here is, if you have to understand the particular symptom better, you should remember 4 things in your mind. These things can increase, but keeping the second years in mind, 4 very important things. Now what are those 4 very important things? One is you should know the sphere of action, and you should know the pathogenesis. Okay? So what I am insisting is, if you have to understand the further part of Chelidonium, you should be very clear with the previous part of Chelidonium, because they are linked. Okay, so what we will understand here is, we look at the sphere of action and pathogenesis, first thing. The second thing we should also remember is ailment storm. Luckily in Chelidonium you have only one ailment, so it's very easy to remember. And you should also remember the characteristic symptom. This we are integrating with knowledge of pathology, with knowledge of OBG, with knowledge of surgery, with knowledge of medicine. Okay. See, in CBDC we have 3 integrations. I don't know if I have spoken about this before. There is something called as horizontal integration, there is something called as vertical integration, and then there is something called as spiral integration. So when we integrate materia medica with the subjects of second year, that is what we call it as horizontal integration. For example, knowledge of pathology, knowledge of forensic medicine, knowledge of second year organ, knowledge of second year medicine, second year OBG, surgery, that is horizontal. Now what is vertical? When you start integrating materia medica with medicine, repertory, fine, or the subjects that you have already done, anatomy, physio, vertically. So that is what we call it as vertical integration. And then there is something called a spiral. Spiral is when we start comparing. For example, if you remember, recall the liver remedies. So what did you do? With the knowledge of your first year, you came up with some remedies. Okay. Fine. Now this is what we call it as spiral. First year, second year, third year, fourth year, material medical remedies we will be comparing. That is spiral. Just keep these terms in your mind. It can be useful in future. So, knowledge, application, knowledge of all these things can make understanding particulars very interesting and very easy. Now we will focus on liver. Keeping this formula in mind, we will try to understand how particular symptoms also can be interesting. Okay? How particular symptoms also can be interesting. So that's very, very important. Okay? So what you already know is, it's a beautiful remedy acting on liver. Okay. Now acting on liver, what will Chelidonium do? So from where will you get this information? This information you get from sphere of action and pathogenesis. Okay. So acting on liver, what is Chelidonium doing? It causes congestion, it causes inflammation, it causes jaundice. So predominantly Chelidonium is a liver remedy. Okay. So many authors, if you read now, Boring, Dr. Nash, Dr. E. F. Harrington, Dr. Clark. So these are the words taken from their introductory lectures. They say liver and gallbladder are the main seat of action in Chelidonium. Okay, liver, gallbladder are the main seat of action in Chelidonium. And we saw this, if you remember the sphere of action, congestion, one of your friend has told, congestion, inflammation and jaundice. These are 3 things which we can also integrate with the knowledge of pathology so that we can understand materia better. And again I have taken this from Dr. E. B. Nash. Dr. E. B. Nash says the liver troubles range from simple congestion. Please understand, or I'll make you understand this statement. it can range from a simple congestion, simple inflammation to severe deep-seated affections. This is what Dr. E.B. Nash writes. Not only congestion, not only inflammation, it can also be thought of in severe deep-seated affections like fatty liver, gallstones, etc. Okay, this is what Dr. E.B. Nash says. Okay, so moving ahead, what you see here is, for a second year student, I have tried to make things very simple. The liver of Chelidonium can be understood at two levels. Okay, see, one thing here is, the liver is sluggish, the liver is weak liver. So what can the probable symptoms that can come up when the liver is weak or when the liver is sluggish? That is one aspect. And the second aspect, as we saw here in the previous slide, there can be inflammation, there can be congestion. So second aspect is actual affection of liver, meaning there can be actual pathology from the liver. Hope I am clear. Okay. So when liver is affected, when liver is not functioning properly, what can be the bodily symptoms that can come up? I will again repeat because I know it is post-lunch session. Your liver and of course your mind, everything will be in a very slow state because energy will be used for digestion. The energy will not be used for concentration. So let's focus, let's concentrate. The question is very simple. What is the question? When liver is weak, when liver is not functioning properly, what could be the bodily symptoms that one can notice?
Paleness.
What is it?
Paleness.
Paleness. Okay, fine. Okay, one of your friends says paleness. I'll come to it.
Indigestion.
Okay, one of your friends says indigestion. Please keep the knowledge of your physiology and anatomy in the background. Okay, fine. You still want to stick to paleness? Okay, no problem. Indigestion. Okay, one of your friends says obesity. Anything else? Simple things, simpler things. Okay, there can be vomiting, there can be diarrhea, there can be nausea, there can be problems with appetite, or there can be bitter taste in your mouth. No appetite. Okay, what made you think of paleness? So when you have said paleness, you will be having something in the background.
Because of improper bile.
Okay, because of improper bile circulation. Okay, maybe, fine, no issues. See, what is very important is, when the liver as an organ, when it is affected and when these symptoms are getting reflected on the body as a whole, see, why I am insisting here is, in physiology you would have studied about liver, in anatomy you would have studied about liver, and the anatomy and physiology teacher would have emphasized on the fact that liver is very important. Not me, I am talking of your anatomy and physio teacher. Because when a material teacher teaches, you will tell material is very important, every drug I teach is important. Similarly, every teacher would have done that. So if you recall the classes done, you would have realized how important liver as an organ is. And when this liver, for some reason, is not functioning properly, then you will be seeing dullness as a whole, sluggishness, no appetite. Okay, no appetite. So bitter taste is what that can come up. No interest in food. You don't feel like eating. These things can come up. Or somebody was very right in telling there can be indigestion. The food you eat because of liver not functioning properly. Liver is a beautiful organ which plays an important role in digestion and metabolism. Okay. So indigestion can come up. Nausea can come up, vomiting can come up. Nausea in Chelidonium is better by drinking warm water. Okay? You got many remedies in the Materia Medica for nausea. If I remember last class we did compare. We spoke of colchicum, we spoke of ipecac, we spoke of arsenic. Okay? Fine? So what is very important for you is, nausea in Chelidonium is better by drinking warm. So there can be vomiting, there can be nausea because of sluggish liver. And this statement I have taken from Dr. Kent's Materia Medica, and he says With liver complaints, slowing down of the mental state. See how beautifully Dr. Kent says, with liver complaints, slowing down of the mental state, inability of the mind to work, sluggishness of the mind, inability to think. So when you have this mental state, because of a sluggish liver, the first remedy you should think of is Chelidonium. Okay, Chelidonium. Now, liver proper. Now again, this is where the knowledge of pathology can play a beautiful role here. Liver proper, what are the symptoms or what are the complaints you have in Chelidonium? So now going back to the spear of action, it can cause congestion, it can cause inflammation, hepatitis. I don't know how much of pathology is over right now, but what I want you to understand is, the teachers will be telling, because we are just in the initial days of our second year. So when you understand pathology and FMT in detail, this becomes very easy. But inflammation, what do you see in inflammation? You can have redness, swelling, you can have pain, and you can have heat. Okay, heat. So when the liver is inflamed, okay, one thing that can come up here is there can be pain. Redness we can't see inside, but you can feel the pain. Patient can feel the pain. So each remedy, as a homeopath, you realize they have different types of pain. Bryonia, Naxmamica, Cinchona, in liver affection, they have their own characteristic pains. Our focus today is what is that characteristic pain you have in Chelidonium. Hope you are getting my point. So Chelidonium al novo. So sharp stitching pain shooting from liver down into the stomach. From liver it is going into the stomach. One. The second area you can contribute. From liver, where is it going? It is going into the inferior angle of the right scapula. Again, if you read gallstone in your pathology, gallstone colic in your pathology, this is a common symptom. From right hypochondriac region, pain going into the inferior angle of the scapula is a common symptom of gallstone colic. So this is what I had highlighted in the last class. Constant pain under the lower and inner angle of right scapula is all important too. And moving ahead, constant stitching in the region of liver. This stitching pain in the region of liver is making breathing difficult. What is it? The stitching pain in the liver is making the breathing difficult in Chelidonium. And gallstone colic when it has got all these characteristic pains, one can think of Chelidonium. Pain in Chelidonium is better by eating. And pain in Chelidonium is better by warm place. Pain in Chelidonium is better by drinking warm. Okay? And pain in Chelidonium is better by passing stools. Okay? So these are the ameliorating factors in Chelidonium pain. Okay? So this slide we are exclusively focusing on the pain part. Pain which can come because of gallstone colic, what we call it as hepatitis. Okay? So this is related to pain. See, beyond pain or beyond inflammation, what else one get to see in Chelidonium? I was talking to you about hepatitis. That's what you are trying to understand. Beyond hepatitis, we also have something called as, this is the normal liver and this is the enlarged liver. Hypertrophy. So hypertrophy of liver, what is the term called? Hepatomegaly. Very good. So hepatomegaly. Fatty liver. Right? So these are few things which you can also see in liver. In liver affections of Chelidonium. Okay. See this, if you just look at the Google image, this is not, I think you are a second year student, pathology, when they start teaching systemic pathology, you can correlate things much better. So what I am trying to tell you is, this is simple distension of abdomen. Seniors can think of cirrhosis, but I am not talking to you about cirrhosis. Okay. This is mainly distension of stomach or distension of abdomen which comes because of poor liver or a sluggish liver. Okay. So jaundice. Kannadalli because it is common. Jaundice. Okay. So jaundice. Any other remedies that you can think of? Cardas is good. Cardas. Lycopodium, very good. Sulfur. Gelsemium. Gelsemium is also liver. Yes, good. Podophylla. One more remedy you can think of here is Nux vomica. Don't ignore, don't forget Nux vomica. What is the indication of Nux vomica in jaundice? Okay, very good. Alcohol. Second very important thing is liver affections after bad effects of allopathic remedies. Too much of allopathic drugs, liver goes into damage, then you have jaundice. One beautiful remedy is Nux vomica. Liver affections because of alcoholism, one beautiful remedy is Nux vomica. Yesterday, because we are talking of, I don't know how much of time I have, but because we are talking of 20 minutes, okay, because we are talking of alcoholism, yesterday I had a case of, disappointed, sad mother who had approached me for a son who is into alcoholism, right? And how do you approach this case? Again, I know the limitations, second year student, but what I am trying to tell you is, a lot of patients, they are knocking the door of the homeopathy. Homeopathy that we were practicing 25 years back, and the awareness the public have today is way different. You are lucky because public, they are aware of a system called homeopathy. So you should thank all the seniors who have worked hard in making this system popular, especially in India. So tomorrow you can confidently start your clinic with a board, whatever homeopathic clinic. Because people can just enter your clinic looking at the board. Whether they continue to come to you or not is your capacity. Right? But at least they will enter. Once they enter, if you give them proper treatment, they will definitely continue. And that's why the classes become very important. Okay. If you are sluggish, if you sleep off now, tomorrow if somebody knocks your door, you will be in a very pathetic state. So you need to be very careful. Any subject, any class your teacher is doing, please be focused. At least you don't have the stress of educating the public. Your seniors have done a great job. There are beautiful association, NCH, they are doing great job in creating an awareness about homeopathy in public. So your job is only to understand, apply what you have studied to the suffering humanity. I was just taking a case of a patient with alcoholism. He did not come to my clinic. Worried mother came to me telling, sir, my son is into alcoholism. Can you do something? Looking at her, listening to her story, pathetic state, I did not have the heart to say no. I said, okay, let me try, because I don't have the patient. But at least as a mother, can you tell me what is the first question you have to ask? Why did he get into alcoholism? See, why did he get into alcoholism? That's when the mother comes up with an incident where he was in love with a girl 10 years back, and she, for some reason, she could not marry him. She married another guy. She is happily married and she is having 2 kids. Fine. This guy till date, it's been 10 years, he is not married another lady, and if she does not call him, or if she does not talk to him, he will start gulping alcohol. Okay. And he cuts himself, he goes crazy, he breaks things, blah blah. So the story goes on. So there you cannot think of Chelidonium. For example, alcoholism, liver getting affected, please don't think of Chelidonium, because this is an entire different state. He's got a classical mental ailment and he's got a classical behavior which fits into a different remedy. Okay. I don't know, but I'll disclose the remedy. He is going mad. So the remedy here is insanity, disappointment in love form. And single remedy, that is tarantula. I know I didn't ask you anti-crude because in anti-crude what will happen? Their maximum can go into suicidal. But they'll not be crazy, in the behavior, cutting themselves. So this is all a destructive thing happening. So the remedy yesterday I prescribed was tarantula. I mean, it's not there in second year syllabus, but it just came because we were talking about alcoholism, and it was fresh in my memory because I saw this case last evening. So, their Naxvamica will not work. Their Syncona will not work. There you have a remedy called tarantula. I hope you are understanding the seriousness. Tomorrow don't be in a fancy world. Somebody comes with alcoholism, if I give Naxvamica, everything will go. No. Nax has its own indication, anti-crude, sulfuric acid, ranunculus bulbosa, ignitia, natrum, hyos, I mean, lot of remedies, they all have their own indications. So this remedy, jaundice, mainly because of hepatic and gallstone pathology. Jaundice because of liver or because of gallstone getting affected or gallstone getting obstructed, not affected, gallstone getting obstructed. What is it obstructing? The bile duct. And in the return what is happening? The bile flow is getting affected. Fine. So this is what I want you to understand. Jaundice, there can be constipation wherein the stools are very hard, round ball-like sheep-dung stools. Constipation alternates with diarrhea. You already know this. Now what is the character of diarrhea we saw in Chelidonium? White, yellow, more important was diarrhea at night. Correct? Yes, diarrhea at night. Involuntary, pasty and watery, and it is more at night. Chelidonium. So this is with the liver affections. And what is associated with liver in Chelidonium? Respiratory complaints, pneumonia with liver affections. Not only pneumonia, even neuralgia, facial neuralgia associated with liver affections. These are very important. So these are concomitant. Okay. So liver, mainly liver as an organ which is sluggish, or liver as an organ when there is congestion, when there is inflammation. This is how I have tried to explain Chelidonium to you, so that you students can remember Chelidonium much better. Okay. So moving ahead, we know this. I have already told you under the characteristic symptoms. What do you see in Chelidonium respiratory? One, you have something called as cough, spasmodic, continuous cough. What was very peculiar in Chelidonium? What was the voice? What was very peculiar in Chelidonium? Sputum. Sputum flies while coughing. Sputum flies while coughing. You saw this? And I told you two remedies in brackets. One is Badiaga and the other one is Calica. Calica. You can have it in the brackets. As and when somebody talks of those remedies, you will get a clarity. Other than cough, what else in respiratory? We saw a slide a while ago. What else?
Short inspiration.
Okay, short breathing. Yes, agreed. Good. Pneumonia. What is special in Chelidonium? Pneumonia mainly of right lung. Pneumonia associated with liver affections. Okay. Any other remedies for pneumonia? Arsenicum, lycopodium, carbovice, good. Antimonium tab. Don't forget. Antium tab. Antium tab comes very close to Chelidonium. Antium tab. Okay. Mainly in infants. Antium tab. Now, how do you differentiate antium tab from Chelidonium? Antium tab has something very important. Now, what is important in antium tab? The breathing pattern. What do we call that? Death rattle. Death rattle. There is a lot of phlegm accumulated. Lungs are paralyzed. Lungs are weak. They are not able to bring out this sputum. And this full phlegm is full, and they have difficulty in breathing. That is antimonium tartaricum. So pneumonia, cough we discussed. See, one more very important thing I wanted to mention in Chelidonium. One of the top 4 remedies in our materia medica where they have a feeling of dust. Okay, the sensation of dust in the air passages, and this triggers cough. What is it? Sensation of dust in the air passage which triggers cough. Only 4 remedies. Top, there are some 50 plus remedies mentioned in your repertoire. One of the 4 top remedies is Chelidonium. Okay. Now the beauty of Chelidonium is you have this sensation of dust in the air passages and you cough. So what happens when you cough? You should feel better, no? But they will not feel better. So when you have a patient who have this particular complaint, sir, there is a sensation of dust, but when I cough, I don't feel comfortable. Single remedy in our materia medica is Chelidonium. Single remedy is Chelidonium. Okay. Pneumonia we discuss. Pneumonia mainly which side? Right-sided pneumonia. Right-sided pneumonia. Okay. Right lung getting affected, and the last part will be the neuralgia. Neuralgia, 2 areas. One is periorbital region. Neuralgia with excessive lacrimation. One. And the second thing, you can also have facial neuralgia. You have this image. Facial neuralgia, right side, when pain is extending into the teeth. Eyes with liver problems. Pain extending into teeth, eyes with liver problems. Chelidonium, neuralgia. And before I talk about modalities, few areas I have not insisted, but you should know is it's again a beautiful remedy for right-sided shoulder pain. Shoulder rheumatism, right side. Pleurisy of right lung. Okay. What is this? What is this shoulder? Frozen shoulder. Chelidonium can be a beautiful remedy for right-sided frozen shoulder. Right-sided shoulder rheumatism. Okay. Done. And it's also got a good amount of mental complaints, mental symptoms, which I'll be leaving it as an assignment for you. You can go back home and you can read about the mind part of Chelidonium. Okay, as an assignment. Fine. So, but for a second year student, one 5-mark question that you can expect is liver complaints of Chelidonium. And why anything they can ask. There is no end. Anything starting from common name till mind. Anything can be asked in Viva. And you should be aware. You should be aware. So the modalities, the last part here is motion, touch, change of weather, 4 a.m. and 4 p.m. Right side. 12 a.m. to 2 p.m. which is the remedy? Arsenica. Okay. 4 p.m. to 9 p.m. which is the remedy? 4 p.m. to 8 p.m. is lycopene. Okay. 4 p.m. to 9 p.m. Colocin. Okay. Fine. So you should know. What are the better with? Hot food, eating, dinner, pressure, lying on abdomen. These are all the modalities of Chelidonium. Modalities of Chelidonium. Okay. So before I close, any quick clarification? Anything you would like to ask? So if you remember, I have insisted on the following objectives. At the end of the session, the learner is able to describe the liver complaints of Chelidonium. The must-know areas is what we are trying to understand. Hope you had some clarity about the liver affections. Boys, done. Second area is we try to explore the respiratory, lungs. And lungs, what did we see? That it's affinity for the right lung and causing bilious pneumonia. See the word mentioned in our materia medica. See, when you understand, what do you understand by bilious pneumonia? Fine? Yellowishness, and more than that, it's got an affinity for the liver as well. So when you have lungs and liver both getting affected, the top remedy that comes up is Chelidonium. Okay, and we also spoke of neuralgia, and then we concluded the class with the modalities. Okay, and as an assignment, You are looking at the mind or the mental symptoms of Chelidonium is an assignment which anyway you have got a series of holidays. So you will be going through and you will be getting back. Okay. So any quick questions, anything you want me to repeat, any clarification? And yeah, before I forget again, Yelan essay. Yelan essay from the knowledge of your anatomy. Flapping of Yelan essay. Okay. Fine. This gives, for example, when they talk, you would have seen few of their flaring of the Yelan essay while singing, while talking. With liver complaints, you have flaring of Yelan essay, Chelidonium. Flaring of Yelan essay. Did I miss anything else? Chelidonium. And the desire for hot things, don't forget. And desires milk, desires cheese, desires milk products, butter. These are the things Chelidonium likes, desires. Okay? Clear? So if it is clear, we'll stop, and the last part was the modalities. Thank you. Thanks.